care leavers in Wales. So for those of you who are not familiar with this scheme, it's an exciting initiative in Wales designed to guarantee a basic income for care leavers. And David's team are evaluating the impact on life chances. This is an evaluation that's underway, David. So you start in 2022 and you're running till 2027. You're combining different data sources. So today's talk is going to talk about the analysis plan as well as some of the issues in access to data. So David is Principal Research Fellow at the Children's Social Care Research and Development Centre at Cardiff. And David's co-leading this with Professor Sally Holland, also of CASCADE, and you're working in partnership with colleagues from King's College London, University of Oxford, the University of York, Northumbria, and the Centre for Homelessness Impact. So very exciting team, David. So I'm now going to hand over to David, and he's going to tell you a bit more about this important pilot and evaluation. And in terms of ADR UK, this data, one of the key data sources is the LEO, the Longitudinal Educational Outcomes Flagship data set. Just to say, we are recording the session, we're keeping your microphones on mute, but if you do have questions or discussion points, please do put them in the chat. Lucy will take over for me at about just after 1 o'clock, and then we'll be convening the discussion. So David, welcome, and over to you.
Thanks, Karen. Hello, everyone. Thanks for coming. As Karen said, I'm here as a sort of representative from quite a big team of researchers. You can see on the slide there, we've got all our logos. So the study's being led by Cardiff, but we're working with King's College London, Oxford, York, and Northumbria. And actually, a lot of the stuff I'm covering today is being led by King's College London. So they're responsible for the impact analysis work stream. So if we go to the next slide, I'll give you a sense of what I'm going to talk about. So it's quite a big study, quite a complicated study, and as Karen said, it runs for quite a few years. So there's no way I can cover all of it in a short space of time, but I'm going to focus on the administrative data portion today. I think that's probably what you're going to be most interested in for this group. But not everyone will know about what the pilot is. So I'm going to start with a bit of a summary of what it is and what it's trying to do. I'll briefly talk about the evaluation as a whole, just so you've got a sense of where the admin stuff fits in. And then I'll go into a bit more detail on the administrative side. And then I'll finish with a few pointers to what's happening next. So firstly, the pilot itself. If we go to the next slide, I think the next two slides actually. There's a title slide in the way. Okay, so I think it's still true to say this is the most generous basic income pilot in the world. So since 2020, there's been a kind of explosion of basic income cash transfer studies where people have tried to see what the impact of giving people unconditional cash is. And these range from very small studies to quite big ones. And this is one of the largest, certainly in terms of the amount of money people get. So it's a targeted basic income study, pilot, sorry. It's targeting care leavers in Wales who turned 18 in between July 2022 and June 2023. So there's a 1-year enrolment period, and people who did enroll got the payments every month for 2 years, so between their 18th birthday and their 20th birthday. Over 600 people signed up. It was about 97% of those who were eligible, so nearly everyone who had the chance took it up. So those who are on the scheme got £1,600 a month, which was taxed, and so they actually got £1,280 a month. As I said, for 2 years, they could get that paid in one lump each month or in 2 portions each month. They also had access to financial advice. In most authorities, it was from Citizen Advice, but some of them had their own sort of bespoke services. And as I said, between 2022 and 2023, we had people signing up each month. So the people the last kind of entrance to the scheme received their last payments in the summer of last year. So the scheme is actually finished now, and we're in the process of collecting data to complete our evaluation. So go to the next slide. There's lots of discussion about who should be involved in this. I think Welsh Government had a big debate about who it should target, whether it should be a kind of regional or location-based thing. They ended up choosing care leavers, and they haven't said exactly why that was, but I think there were quite a few reasons to choose this group. So we know that they are disadvantaged in various different ways. We see that in statistics on education, on employment, on health and on housing. And particularly around the point where they turn 18, there's a kind of accelerated transition where they're expected to sort of take on a lot of responsibility, live independently. And that contrasts quite starkly with their peers who are not care experienced, who often stay living with their birth families for longer. And there was a lot of support in Wales for care leavers, but I think there's a general sense that there's still improvements that can be made. So the pilot was implemented in that context. So if you go to the next slide. People often talk about it as a sort of UBI experiment, universal basic income. And obviously it's not universal, but it does have some of the other kind of key characteristics. So it's periodic, it's predictable, it's payment in cash, it's paid to individuals, not families. And I think perhaps the most interesting thing about it is it's unconditional. So that contrasts quite a lot with most sort of welfare interventions. People get the money, they can spend on whatever they like. There's no conditions attached. And the only condition in terms of being involved is being a care leaver and being in that age bracket. So there are no conditions, which makes it quite an interesting policy to evaluate. Go to the next slide. So that's the pilot in a nutshell. I'm going to talk about the evaluation at a sort of similarly high level. Obviously, there are lots of aspects to this that I could go into more detail. I'm happy to answer questions at the end. But we started with a few kind of key principles. So we wanted to involve care experienced people in every aspect of the study. So we've got a co-production work stream. We've got a group of young people who've been through the care system, who are in the early 20s mostly, so they're a bit older than the cohort, but they've advised us on various aspects of the design, and they will be increasingly helping us in terms of the interpretation of findings as we move towards the end of the study. But they've already done some of that because we've already published some qualitative findings. They've been very heavily involved. They've given us some really good advice at various points, so we're really grateful for their input. We also wanted to take a theory-based approach, so it's not sufficient to just say what the impact is, but we also want to try and understand how those impacts happen. So we're publishing a report tomorrow. It's a third of our annual reports, and it's going to contain an updated theory about how the pilot might have an impact. Because the pilot itself is an interesting one, because in theory it kind of classifies as a simple intervention, but because it's being put into a complex system, I think it has all the hallmarks of a complex intervention. And as such, you need a combination of different methods to evaluate it, to answer different types of questions. So we're using qualitative and quantitative methods and a whole range. We also, this relates to the administrative data, particularly want to lay some foundations for further research on the longer term impact, because although it's a fairly long evaluation, we're only going to be able to talk about the short term impact. And hopefully with the use of admin data, we can follow it up, follow the cohort and the comparator group further into the future to see whether there are any long term effects. I was about to press my down button, but I'm going to have to ask Marie to go to the next slide. So we have several research questions. The first one is bold on the slide, because this is the one I'm going to focus on today. What's the impact on the young people who receive the basic income? And that we'll say about outcomes in a minute, but that covers various different outcomes. We also have questions about implementation, as you'd expect, how it's experienced by people involved, how it sort of fits into what else is available for care leavers. And we also have a work stream led by Oxford University on cost effectiveness. So all of that's going to come out in future reports. So if you go to the next slide. The smiley face on this slide is where we are now. So yeah, the pilot started in July 2022, as I said. Evaluation started in November of that year, and then we've been working since then, and we're planning to publish our final analysis of the impact and economic outcomes in 2027. So it's a long study, but there's quite a lot to do, so it's good that it's a long time. I think that takes us to the next slide, which is the analysis of impact, which is the main kind of focus of today's talk. So unusually, I think, there is no primary outcome. So we haven't specified an outcome that's kind of most important. We've got a collection of outcomes, and the Welsh Government is sort of equally interested in all of them. And these are things that partly things that the Welsh Government cited at the start. There are also things that the research on basic income has uncovered as being things that the basic income might impact. And I think one of the interesting things about cash is, compared to most of the things we evaluate in children's social care, cash kind of has in theory, could affect any aspect of someone's life, which does make it difficult to sort of specify a primary outcome and sort of think about secondary outcomes. There's lots of ways in which cash could help someone, I think, and our logic model, which I mentioned, sort of illustrates that. So this is the list of sort of domains that we're interested in. So well-being, financial security and literacy, community cohesion and engagement, the effects of poverty, access to labour and education markets. The labour one particularly has been a kind of hot topic in basic income debate. Volunteering, life skills, physical and mental health. So all of these things are things that we're interested in and measuring in different ways. So go to the next slide. Most people know that I'm very keen on randomization. In this case, unfortunately, for various reasons, we couldn't randomize, partly because we started the evaluation after the pilot was already going, so it was an existing policy. And everyone in Wales was eligible to participate, which creates a kind of challenge, I suppose, for an evaluator. So we had to try and figure out what would have happened without the pilot, so kind of a credible counterfactual. And we do this in a quasi-experimental way in this study, so trying to mimic an experiment, but not actually randomizing. And we've got various comparison groups to compare those who are on the pilot with different groups of people who are not on the pilot. So there remain two main approaches to doing this. One is surveys, which I won't say too much about, but basically we've done a time one baseline and a follow-up survey with both the group on the pilot in Wales and a group of young people who are also in Wales but too young to be on the pilot, so the ones that turned 18 the following year. So that's the survey. The survey includes lots of things about it's very strong on well-being. It covers various other outcomes as well, but that's the kind of benefit of that, because it covers things that we can't get from administrative data, so well-being particularly. It's administered by Core and Voice, who are a children's rights charity, so they're also commissioned by Welsh Government as part of the study. And then the second approach is administrative data, and we're using something called the Longitudinal Educational Outcomes Dataset, LEO, which links education, employment and earnings records. And the key thing about that is it covers Wales and England, so it allows us to compare care leavers in Wales to their peers who are the same age but based in England and therefore not able to join the pilot. So if we go on to the next slide, I think we've got some more detail about this. So the National Pupil Database is linked with records from HMRC and Department for Work and Pensions. There are kind of two separate LEO datasets. The Welsh one is held by Welsh Government and you access it through the Welsh Government Secure Research Platform. The English side, which is mostly the same but slightly different, I think, in terms of the data that's there, is a DFE thing, and it's accessed by the ONS Secure Research Environment. Like I said, things like employment status, earnings, benefits, education are all in there. There are some challenges which I'll talk about later, but one of them is that it doesn't distinguish part-time or full-time, so you can't tell hours someone worked. So you have to make a few inferences in terms of those things. But overall, it's a pretty valuable resource. It hasn't been used that much in research before. I think it's kind of existed for a long time, but it's only recently become available to researchers. So it's a bit of an unknown quantity, I think, compared to something like the SAIL database, which is much more widely used, or indeed eChild. It's a bit of an unknown quantity, but it does have some advantages, particularly the kind of Welsh-English comparison. Because I suppose one of the disadvantages with the survey approach that we've taken is that the comparator cohort are younger. So things that happen, cost of living crisis getting worse, for example, will make that comparison difficult. We did originally plan to do a comparison group survey in England, but for various reasons that wasn't possible. So I think one of the themes of this evaluation is you have to kind of think on your feet and change your plan quite a lot, and have lots and lots of contingencies. And we're at the point now where we're gaining access to Leo, both on the Welsh side and the English side. And there are lots of kind of challenges and hurdles to navigate, and it's quite a long process, but that's the plan. So if we go to the next slide, I've kind of covered most of this, I think. Yeah, and I guess the key thing about Leo is that there's a care lever marker, which means that it allows us to create a counterfactual group in the English side. What else have we got here? I suppose the classic comparison between admin data and survey data holds in that the surveys are very good at getting self-report on things like wellbeing, but they're less good at getting reliable information about employment and tax. So the two data sources kind of contrast and complement each other quite nicely. The other big advantage, obviously, of the administrative side is we should be able to get data on nearly everyone, whereas in the surveys we're relying on kind of varied response rates. And although we do have a good response rate for the time one recipient survey, it's been more difficult to get response rates that are adequate on the comparator group side. So the administrative side sort of fills in some of the blanks in that sense, and it gives us a much bigger sample to work with, which is always good. It also means we can track at different time points. So we can track outcomes before, during, and after pilots, not just at the points when we're doing the survey, which is obviously an advantage as well. Okay, next slide, please. So what we're going to do with this data when we've got it? Well, we're going to use a quasi-experimental approach, which is becoming more and more popular. It's called difference in differences. But before that, we're going to match people, and we're going to do that in two ways. And I say this is the plan. What actually happens maybe one of our, may have to resort to one of our contingencies, but the plan is to match similar people in similar places. So we've got a list of local authorities in England that are most similar to the 22 local authorities in Wales in terms of deprivation, demographics, and so on. And from memory, a lot of them are in the northeast of England. So we find quite a lot of sort of similar characteristics up there compared to Wales. So that's the first level of matching. And then we've done that prior to the analysis, obviously based on data we can get. The second level is matching individuals, which we do when we've got the data itself. So the idea is we match people on their characteristics. And we're using coarse and exact matching, which is a sort of middle ground between exact matching, which is you match people who are exactly the same on certain demographics, which is probably not feasible in our case, and something like propensity score matching, which is much more liberal, and you might end up matching people that are not that similar. So it's somewhere in between. So you have a kind of characteristics that are sort of looser than exact, but not as liberal as propensity score matching. So, and then the difference in difference basically looks at whether there is a difference in the trend over time, and if there is, then we assume that difference is the effect of the intervention. There are various assumptions that this is based on, but there are things that generally you can check using the data. So we go on to the next slide. I keep hovering my finger over the button, thinking I'm in control, but I'm not. So there are various assumptions, as I said. So we know that the policy wasn't introduced because of some change in care leaver outcomes in Wales compared to England. Without the pilot, we think there would have been a similar trajectory in terms of these outcomes. They don't have to be the same, but they have to sort of follow a similar trajectory over time. As I said, we can test that. We know that English care leavers were not affected by the Welsh pilot because there are very strict criteria. We know that there are no other policy changes at the time that we think are affecting only Welsh care leavers. Obviously, this could have happened, but as far as I'm aware, there's nothing that would fall into that category. And the groups remain stable over time, so people continue to be care leavers, essentially. So there are various constraints, but I think all being well, this should work and should give us a fairly robust estimate of impact. Okay, next slide. So we've got these outcomes, which I've covered mostly. There's a bit more detail on this slide, but it basically should tell us a lot about education and employment and benefits and things like that. So one of the things that's quite a hot topic in basic income is whether basic income pilots should increase employment. there's some critics say that they should, and they criticize basic income pilots when they don't, whereas defenders of basic income would say, well, it isn't designed to increase employment, but it's a good thing that employment doesn't go down. And most studies have found that employment hasn't really gone down very much. So that's an interesting debate that I think this study will speak to. We measure this at various points, and as I said, we're able to look at all 644 young people who are eligible. Obviously, 97% of those took part, so a few of them won't be, but it's an intention to treat analysis, which I think is appropriate at kind of policy level for something like this. Okay, next slide. What am I doing for time? A couple of minutes. As I said, there are various challenges, and I think we can cover some of this in the discussion and the questions, hopefully. There are slight differences between Leo in Wales and Leo in England. I haven't quite got my head around exactly what they are or why, but they make it more difficult to do some of the comparisons, but I'm assured that the King's team are on top of that. There's a lot of kind of bureaucratic hurdles, and I think this is probably true for most data linkage projects. Some of my colleagues here do much more of this than I do, and I know that they're often having to make various applications to different things, and this does take a long time. So I think you have to build that into the plan. Obviously, we've got the luxury of having a few years to do this, but even then, depending on when data becomes available, you're on a bit of a timeline that you're not necessarily in control of. It doesn't always become available as frequently as we like. I think there was a delay actually in the English Leo being updated. So there are some anxieties that arise around that. But like I said, you have to sort of keep your fingers crossed. It doesn't have health data in the way that SAIL does, or eChild. I've got about 1 minute to go, so I think I'm more or less on time. Doesn't have health data, so you are limited in that sense. But I think, we hear that the Leo is constantly being updated, or that there are plans to update it with different data sets. So hopefully in the future, if we come back to it, there may be more that we can do in terms of the analysis, more outcomes and so on. I mentioned the thing about data on hours worked, so there's some things that aren't quite as clear as you might hope them to be. And the other thing that we're grappling with at the moment is that it might not be possible to get them all the data into one secure research environment. So there are various kind of things that the team are doing to overcome that. And it's not insurmountable, but it does make it more difficult. Okay, we go to the next slide. I think there's just one about the different, so this is basically what I said before about the different data sources. And what we're hoping is that in the round with all of our different types of data, we'll be able to give a fairly complete picture of how the pilot has made an impact, both at a policy level, but also at an individual level. So we've got in our report coming out tomorrow, we've got lots of individual stories from qualitative interviews that we've done about how the pilots worked for different people. So I think that's interesting. And I think the theory that we've developed from that also maps across to the impact data that we're going to be gathering. So it all kind of hopefully speaks to each other and gives a sort of full picture. Like I said, the other part is the economic evaluation that colleagues at Oxford are working on, which will be about cost consequences and social cost benefit analysis, which I don't think that many of the basic income pilot evaluations have focused too much on economics. There are a few, but it's a bit of a gap. So I think that should be an interesting part of the project as well. So as Karen said at the start, I think we're planning to finalise this in 2027. So we've got a report out tomorrow, and then 2 in 2027 that will cover off all of the work streams we haven't yet reported on, including the impact data that I've talked about today. And then I think we've got one more slide, or possibly 2. Yeah, so this is just about what we've published so far. So we've been doing a report each year. And like I say, we've got a protocol published in PLOS One. We've got an even more detailed statistical analysis plan on the Welsh Government website. So if you're interested in some of the stuff I've said, but want more detail, then those 2 documents are the ones to look at. The reports cover various findings so far. And then I think one more slide maybe, and then I'm done. There we go. As I said, as I keep saying, we have a report published tomorrow. And we've got 2 more in 2027, and we're in the midst of data access for Leo. So I've kept we have to keep to what's in the public domain with these these presentations. So I've kept it at a fairly high level, but very happy to answer any questions you might have. I think that's been done. Thank you, everyone.
Lovely. Thanks, David. That was an excellent talk. Really, I think, insightful in terms of the need to kind of revise and be a bit nimble around some of your analysis plans in relation to these tricky data access issues and data quality issues. So I'm now going to hand to Lucy and just say thanks. I'm disappearing off to another meeting, but Lucy, handing over to you for the rest of the discussion. But thanks again, David.
Thanks, Karen.
David, so this we have had some questions. So have you collected social, economic, cultural data about participants, and will you use this in your analysis of the policy's impact on different communities? Or do you think that the cohort is too small to draw meaningful findings about particular groups, and to do so may risk creating stereotyping?
It's an interesting question, yeah. So I think we will have some of that data, but yeah, as the questioner sort of implied, I think we'll have to be quite careful about how we use it. I think we'll look at it to see whether there's anything that we could do with probably quite small subgroups. But yeah, so we'll have some of that, I think, from Leo, and also some from surveys. And there's also another data source I didn't mention. There is data that Welsh Government collects at the start when the young people enrol, and then again at the point of exit. Which is kind of a bit like a survey. It covers lots of demographic stuff, but also there's a health question, for example. So there's some data collected there that also might help us look at some of those things. But yeah, I think it depends. I haven't seen the data yet, so I don't know how big subgroups would be. I think, yeah, we'll have to make a decision about that. But I think there is potential to do some of that.
Next question. In considering different quasi-experimental designs for the impact evaluation, did you consider regression discontinuity designs?
Yeah, so we definitely talked about that. I think the problem with regression discontinuity is you need very big numbers or a very wide kind of what's the word, bandwidth around each point. I think I don't know exactly the plan, but Michael Sanders, who's leading the impact evaluations, talked about potentially using regression discontinuity as a robustness check. But yeah, I think we're actually considering it for a different evaluation that we're proposing to do, where there's much bigger numbers. But I think with this one, the numbers are probably a bit too small.
What well-being outcome measures do you plan to use?
Yeah, so I use, as I mentioned, Core and Voice, the Children's Rights charity who are administering the surveys. So the survey was largely finalised before we started. We were able to add a few things in when we started the evaluation in November 2022. It's based largely on the Your Life Beyond Care survey, which they use in England, and they've used a lot with lots of people in different local authorities in England. So. And that does involve various standardized measures, none of which I can think of right now, but we do. Yeah, it does involve some standardized measures of well-being and some physical and mental health questions as well, which are from standardized measures. There's one on the tip of my tongue, but I can't think what it is. But yeah, it's basically the Your Life Beyond Care plus a few extras. And the good thing about that is also it gives us. We can compare with the data that they've got. They've been collecting for many years, and it's a pretty widely used measure. So, yeah.
I guess linkage of Leo to health data is presumably on the wish list further down the line.
Yeah. So when we first started, there was talk of some health databases being built into Leo. So I think hospital episode statistics was one that was mentioned. And possibly some others. So I don't know what the likelihood of that is or the timescale, but I think there is definitely an appetite within DfE and other government departments to try and integrate more into Leo. But it does seem to be quite a slow process, so I don't know when that would be possible. But yeah, it would be great to have health outcomes in there as well, definitely. Actually, because partly because some other basic income evaluations have shown increase in use of emergency departments and things like that. So I think it would be interesting to look at that.
Really. Thank you. There's lots of questions coming in. So the next one, what was the exit strategy for care leavers that had got used to the payments? Do you know if there has been an impact upon young people since their payments stopped, e.g. increased debt to keep their altered income and lifestyle? Is there post-study support for them?
Yeah, so this was a big point of discussion throughout the pilot for Welsh Government colleagues, particularly who are administering the pilot. So there was an exit strategy that was done in collaboration with the local authorities. So Welsh Government led it and worked with all 22 authorities to make sure that the personal advisors who are working with young people were preparing them for the exit and so on. And it's my impression is that that's gone pretty well. I think in terms of making people aware that the pilot was ending and what would happen and what the sort of where they could get support seemed to be fairly successful. I can't go into much detail, but we are in the report that comes out tomorrow. There are some examples where young people have been interviewed about the exit process, what it was like before, and what it was like after exiting. So there's a lot of really interesting qualitative data about how that affected some individuals. But yeah, I think so some people, some of the basic income pilots have actually implemented a system where they taper down the payments so people get used to having a bit less each month and so on. And it was decided, I think, that wasn't possible here, partly because of how it interacts with benefits. So it makes it much more complicated. And one of the reasons the payment was set at such a high level was that it kind of simplified that in the sense that it basically took out any interactions with benefits for almost everyone. So there are some sort of practical constraints around how that could be managed. But yeah, the report tomorrow has a lot of stuff around that.
Right. So you're leaving us hanging, but not for too long. It's perfect timing. Okay. Can you say more about the qualitative package? Are there any early findings you can share? How did the feedback from the Lived Experience Advisory Board feed into your evaluation?
Yeah, so I'll start with the last question. So the advisory board, they were really helpful when we were talking about, I mentioned the survey, we made some changes to it. They gave us some really helpful advice on that. And in some cases, there were things that the professionals involved were like, oh, not sure we should ask about that. Things like in criminal justice involvement, for example. But the group of young people that we work with they felt we should ask about it, so they sort of pushed back on some of the professional concerns. For example, they give us various other helpful advice about different types of questions, different things to ask about in the survey, and in interviews, the qualitative interview schedules as well. What was the other part of the question, Lucy? Was it something about qualitative package?
Yeah. Any early insights from the qualitative work?
I think in our second report and in the one coming out tomorrow, we've covered some stuff from the interviews of young people. So we interviewed young people and we asked them to nominate a supporter. So that could be someone who they knew closely. So it could be a friend, it could be a family member, a foster carer. So we interviewed about 20 supporters and about 45 young people at 2 time points. And I think it's fair to say it's a mixed picture. So people spent their money in lots of different ways. People had lots of different types of experience. Some felt it was very positive. Others found it more challenging. I think there's a wide range of experience. And I suppose one of the things about this, the impact evaluation is it's going, by looking at an average treatment effect, is going to mask quite a lot of the variation within the cohort. So I think it's really important to look at both the sort of policy level, what effect did this have, and at the individual level, how do people experience it? Because there is a really wide range of examples where people have used the money in different ways and kind of had different experiences on the pilot.
I'll just try and cover as many of the next questions off as possible within the next 5 minutes. So next one was, do you know anything about the 3% who didn't sign up for the pilot?
Wish I did. No, we don't. We didn't collect any data on them. I would like to, but yeah, we don't basically. Anecdotally, we've heard that in some cases it was people who didn't trust the authorities, didn't want to kind of involve themselves in something like the pilot. But yeah, we don't have any sort of systematic data on them, which is a shame.
You mentioned case studies for your evaluation. How many case studies will you compile, and what percentage of the participants?
I don't know if I mentioned case studies, but we so the qualitative, it might be qualitative data that the person's referring to, or maybe I said case studies by mistake. But yeah, qualitatively, we've interviewed, I think it was 44 young people at time one, and we did a midpoint interview with a smaller group, and then we've done a final interview with between 30 and 40. I forget the numbers now. So quite, yeah, a number of people, not a kind of representative sample by any means, but enough that we've got quite a range, like I said, of different experiences. And we've also got a range of people from different parts of Wales. So we've got some people from north, south, cities, countryside. Yes, there's quite a range in terms of where people are living and yeah, which part of the country they're in.
You mentioned foundational work for research on longer impact. Can you speak a little bit more about this point?
Yeah, so I think ideally we'd like to. I mean, obviously, it depends a bit on what we find. It's going to be a harder sell for a funder if we don't find any effect. Although I still think you could sort of feasibly see longer term effects emerging later, maybe. But I think what we've talked about is maybe turning it into a kind of a cohort study where we could follow the intervention group and the comparator group further into their young adulthood to see how effects materialize. And I think another, so that we could do that with Leo. I think that there's also potential for using other data sets like SAIL, for example, to do some longer term analysis and to see what impact the pilot might have in sort of 5 or 10 years. So yeah, so one of the benefits, and so obviously with surveys, it's very difficult to do that because you've got to maintain the response rate, whereas with this type of data collection, there is a potential for doing longer term follow-up, which I think is potentially really exciting.
And the next question builds on that in terms of, are you hoping to measure differences in criminal justice outcomes as well, or would you require separate linkage to other MOJ data for that?
Yeah, so I think it would require a separate linkage, but it would be something we'd be very keen to do because care leavers are overrepresented both in criminal justice, both as victims and as perpetrators. So it's clearly a relevant issue for this group.
Given the challenges you've identified with the Leo data, particularly absence of health data and hours worked, and the fact that wellbeing and mental health were core outcome domains from the outset, how confident are you that the final 2027 report will be able to draw meaningful conclusions across all of the original outcome domains?
Yeah, that's a good question. I think a lot of the well-being side of things, and I think I don't know, but my sense is that that's probably one of the areas that's more sensitive to change. That relies on the survey very heavily, which relies on the response rates. And as I said, we've got good response rates on the intervention group, by and large. Less good on the comparison group, which is what you'd expect because they're not as sort of bought into it. But we're collecting follow-up comparison data now. Got a big push on response rates, so we're hopefully going to get a decent response rate for the time to comparator. And I think if we do, then that'll give us a fairly good shot at saying something meaningful. And I think although it's kind of a patchwork of different methods and different sources, and that's partly by design because nothing is kind of foolproof. So between everything, I think we'll be able to paint a fairly good picture. But there will be some things that we're not so confident about, and some data sources that we can't necessarily rely on as much as we'd like to.
Okay. There are lots of questions. I don't think we're going to get through them all, so I'll just leave you with this last one. And then maybe if you had time, David, just to type in the answers for the other ones. Apologies, everyone, if I haven't got to your question. But if the 2027 findings show no significant impact, what would that tell us? That basic income doesn't work, or simply that the pilot wasn't designed in a way that could detect its true effects?
That's a big question, isn't it? So I think there have been other basic income studies that have in recent years that have had, I think, for advocates of basic income, disappointing outcomes. And I think, so I think this is got to be seen in the context of being a targeted program in a particular place, implemented in a particular way. So I think although we can be confident about this particular policy, you need to be careful sort of extrapolating to basic income more generally. Personally, I think there's quite a lot of potential for unconditional cash transfers in different fields. I mean, I'm on the fence about certain aspects of it, but I think for certain groups, there is potential for cash. But I think a lot of it depends on implementation. It might tell us that this age group isn't the right age group. It might, there's lots of things that could tell us about the particular design of this policy. But I think, as I said, there's been a big increase in cash transfer basic income pilots across the world in recent years. And I think, incrementally we learn more with each one. And I think there's a lot of sort of, a lot of lessons for policy, but I think across the piece rather than from an individual study, although, for this particular pilot, I think it'll say a lot.
Great. Thank you, David. I will close the session here. Thank you for the wonderful number of questions. It really shows how engaging the project is. And for those of you that we haven't replied to, we can get back to you with brief responses on those. Marie, have you been able to share the evaluation for us?
Yeah, I've put the feedback form in the chat, and I will send the link out to everyone with the recording and the slides.
Yeah, thank you, Marie. And thank you all for attending. So we have a couple of meetings coming up. Webinars, I should say. So our next webinar is on the 11th of March, and then we have another one on the 23rd of April. So please continue to stay engaged within the community. And thank you for joining and taking up your lunch break. Thank you.
Thanks, everyone.